My name is Stefan Georgi, and I'm here today with Dr. Ken Eagle. He is with Eagle's Touch Chiropractic in Melville, New York, and he's part of the BrainCore Therapy of New York group. We want to talk really quick about ADHD therapy options, both in Melville and in New York and nationally as well, and look at some alternatives to traditional ADHD medications that can be effective, but that may also come with side effects and other concerns, whether those be with children with ADHD or adults. So, Dr. Eagle, if you'd like to introduce yourself and a quick background about your practice and BrainCore, and then, if you want, you can even start to get into that as far as how you guys handle ADHD and what your kind of unique approach is to it.
Sure. Thanks, Stefan. Dr. Ken Eagle, I'm located in Melville. Been in practice for 19 years, and I am now board certified in Neurofeedback, which I believe currently there's only about 20-25 chiropractors in the world that are board certified at this point. But we've got a lot more of the BrainCore family that is coming on and getting their board certification. Which is great. And basically, I work with a lot of different types of conditions, and one of them, which is very popular, is ADHD, which is just kind of rampant in society at this point. Right now, the typical intervention for it is medication. Mainstream medicine likes to give stimulants. Basically, on a brain level, what we're doing is, in a traditional ADHD presentation, a child or an adult will come with a differential of their theta to beta brainwave. There's a lot more, in layman's terms, a sleepy brainwave than there is a more alert brainwave, which seems sort of counterintuitive because a lot of these people are actually hyperactive. So what's happening is their brain is actually falling asleep, and for them to stay alert, they have to really switch and change their attention just constantly. So there's a shortage of the beta brainwave in the ratio. So with kids, it's somewhere around 3 to 1. With adults, 2.5 to 1 theta to beta ratio. What mainstream medicine likes to do is give a stimulant to bring that beta brainwave, that alert, awake brainwave, into ratio. So they try to raise that and stimulate the child that way. It's a short-term fix if it does work, and it has to be done daily. And there's a lot of side effects that go with it, and a lot of long-term issues that go with it. But what we do is we actually analyze the brain, find out what areas are regulating properly, what areas are not regulating properly, and then we actually do training sessions in the office with other people where we actually teach our patients to self-regulate so that they actually learn to correct that ratio of theta to beta naturally within their brain, and it's something that is a very long-lasting fix that doesn't have side effects associated.
Cool. And well, within using neurofeedback for ADHD, and maybe get into a little more how they train their brain, the specifics of that, and then maybe share the results that you guys typically see. I know you said that they're long-term, being a fix, but maybe think about just what are the results I would typically see if I had ADHD and I underwent neurofeedback training.
Oh, okay. So again, what we do is we do a quantitative electroencephalograph. It's also known as a brain map, where we analyze 12 areas of the brain. It's completely non-invasive. We put on a cap, we connect to the computer, we do recording. We send that information to the database. It's a normative database with 50,000 other brain patterns in it, and analyze that data and tell us the areas that are regulating properly, which areas are not regulating. If there is a beta-beta differential, that's sort of rudimentary check, but it's included also within this brain map we have the ability to. Once we've identified the areas that aren't regulated properly, we have the patient come in. We put on some simple wires onto their scalp and a couple of ear clips, hooked up to the computer, and we have them do an activity on the computer. It's typically a movie or a game, and we set the training protocol for them. And when the brain is being balanced in a training position, to say it's a movie, the movie plays bright and plays loud. When the brain, one of the parameters is outside the desired area, the movie will then dim and the volume will drop. Stefan, you still there?
Perfect.
I kind of dropped on you.
Yeah, I know. I felt the same way. I'm not sure, and you came back. Hopefully, I'm glad that we reconnected. Where I had you at, which was essentially you're talking about the wires that are connected, but that it's non-invasive. It's not like there's any it doesn't go in your scalp or anything. It's connecting to your head. But yeah, and then I guess if you want to just kind of finish the thought on how the feedback is sort of given to the patient.
Okay.
Yeah.
Absolutely. So they come into the office for a training session. We hook them up to these wires. It's again non-invasive, and they observe something on the screen, whether it's a movie. Most of my patients use any movie that they are interested in watching. Sometimes we do games or puzzles, or there's a Pac-Man game. There's lots of different things they can do. But typically, most do movies. And when their brain is in the training zone, the movie plays bright and plays loud. When their brain is outside the training zone, the volume drops. And over the course of a 20, 25-minute session of training, somewhere between 250 and 250 times, their brain is actually exercising using the feedback of instantaneous results, showing their brain, hey, this is where my brain wants to be, or this is where my brain isn't, this is where my brain wants to be, this is where it isn't. It learns, and over time, it actually develops new what we call circuitry, to compensate for the areas that haven't been working properly.
Cool. And then just maybe as a last question here, the results that you see again, they're long term, like you've mentioned, but does it tend to be pretty effective for people like all ages, or what do you kind of tend to see with your patients who do neurofeedback for ADHD?
Well, we've had phenomenal results. I would say, I've never seen a brain not get healthier, so let me just say that. Brains can get healthy. It's called neuroplasticity, and it's possible in very young and very old. But we've had phenomenal results, and currently the American Academy of Pediatrics lists neurofeedback, which is what BrainCore is called, as a level 1 intervention, which is the same level as medication, only it doesn't possess the side effects of medication.
Wow. Awesome. Well, cool. I think that gives a really good kind of breakdown of both, neurofeedback for ADHD and why it's an exciting alternative to traditional medications. Now, they can find out more about your practice, Dr. Eagle, through the BrainCore New York website, which is www.braincoreny.com. You also have a phone number for your practice you want to give?
Yeah, certainly my office is the area code is 631-385-1400. I have my own website as well. It's www.theeaglestouch.com. And again, the BrainCore NY site.
Absolutely, and you're in Melville, New York, but helping people in that area, right?
Absolutely. I'm in Melville, and I'm also in Astoria.
Cool. Awesome. Well, thank you for your time today, Dr. I really appreciate it.
Thanks, Stefan.
Absolutely.